everyone. Thank you for joining our webinar today, which is all about how to better support people with dementia within the context of providing domiciliary care. I'm Ilaria, I'm the Onboarding Customer Success Manager here at NurseBuddy, and I will be your host for today's session. With me is Dr. Emma Williams, which is our guest expert for today. Emma is a certified behavioral analyst and the founder of PAT, which provide behavioral-based online training and consultancy for all carers of people living with dementia. Today, Emma is going to talk about some of the behaviors associated with dementia that can be challenging for carers like yourselves to deal with and offer some advice on how to work with them. A very warm welcome to Emma. So, on today's webinar, we'll start with a presentation from Emma, and then we will go into the Q&A session. If you'd like to ask Emma a question, please use the Q&A feature here in Google Meet. You can click on the activities icon at the bottom right of your screen. It will look like three shapes, and then choose Q&A. If you're on a mobile device, please use the three dots to see it. Then you can type in your question, and we'll do our best to get to as many as possible. A reminder that we're also recording this session, so we'll send you a link afterwards. I think we're all set, so over to you, Emma.
Hi everyone, so thanks for that introduction and thank you for joining us today. So I'm Dr. Emma Williams and I'm a behaviour analyst specialising in dementia care, and I've worked in the care sector for about 27 years now. And what I do is work with caregivers and healthcare professionals to support older adults who are experiencing distressed behaviours, helping to improve their quality of life and the care that they receive. I'm also the director at PACT, Positive Aging Consultancy and Training, where we focus on bringing behavioural sciences into dementia care. So before I start, I thought I'd cover what exactly is a behaviour analyst and what we can do. So behaviour analysts study why people behave the way they do. We look at what happens before and after a behaviour to understand its purpose or its function, so why that behaviour is happening. And by identifying the reasons behind behaviours, we can then help to develop tailored and evidence-based strategies that are person-centred, and that will be to reduce distress behaviour and improve overall well-being, and also reduce the need for damaging antipsychotics that are sometimes prescribed for behavioural issues. So behaviour analysis is a scientific field, and its principles are widely used in areas like education, mental health, and within learning disabilities. However, access to specialised behavioural support for older adults, especially those living with dementia, is actually incredibly limited. So globally, there's around 10,000 behaviour analysts, but only about 80 of us specialise in dementia care. So most other behaviour analysts work in areas like autism. And this means that older adults, especially those in dementia care, are often overlooked when it comes to accessing this type of expertise. And the reality is that distressed behaviours in dementia, like agitation, wandering, or aggression, are not just part of the condition. These behaviours always happen for a reason, and they're ways of communicating unmet needs. So as a behaviour analyst, I work to uncover the reasons behind those behaviours and then work with caregivers to provide strategies to help support with them. And when caring for someone with dementia, you might notice that some behaviours can be really challenging to support with. And it's interesting to know that up to 90% of people who are living with dementia experience some form of distressed behaviour. And like I just mentioned, a really common misconception is that those behaviours are simply just the dementia, but this really isn't true. So all behaviour happens for a reason, and it's signalling an unmet need that needs to be addressed. So first of all, understanding why those behaviours occur is really key to providing effective support. And just to give a kind of quick idea, generally speaking, distress behaviours normally happen for kind of four main reasons. So our first reason is to access some kind of attention. So the person might be seeking connection or reassurance. So for example, they might repeat questions because they want to engage with you or feel secure. And some people refer to this as attention-seeking behaviour, which I personally think sounds quite negative. After all, we all kind of seek attention sometimes, whether that's a chat with a friend or a partner, or to be complimented or told we've done something really well. So personally, when I'm referring to behaviour that's caused by a need to access attention, I tend to call it affection seeking because it sounds a bit more appropriate and less negative. Our next main reason for seeing behaviours is to escape from something, so to get away from something. And sometimes those behaviours happen because the person wants to avoid something that they find unpleasant or overwhelming or confusing. So, for instance, refusing personal care could actually be their way of saying, I'm scared, or I don't understand what's happening. Our next reason is sensory related. So that relates to how the person's experiencing their environment. They might be too hot, too cold, they might be in pain or overwhelmed by noise or light. And sensory issues can lead to agitation or pacing or withdrawal from a situation. And then our last reason is to access something, so something tangible. And this means they're trying to get something they need, like food or a drink or a favourite item. If they're kind of hungry or thirsty or can't find something familiar, it can lead to a lot of frustration and distress, as you can imagine. So we also have physical causes to consider. This could include pain, hunger, thirst, or discomfort. So, for example, someone might become really agitated if they've got a urinary tract infection or are too hot or too cold. So before we actually go into any behavioural treatment, we will always get medical causes ruled out first, just to make sure there's not a medical reason for those behaviours happening. So when you meet someone living with dementia for the first time, you might notice behaviours like confusion or repetitive questions, forgetfulness, or difficulties with kind of recognition. And you might also encounter distress behaviours such as agitation, pacing, or emotional outbursts. And it's really natural to feel nervous or unsure when you're faced with those situations, especially if this is new to you. And I just kind of want to reassure you that feeling this way is absolutely completely normal. What you can try and do is just remember to stay as calm and patient as possible. So sometimes just giving someone living with dementia time to process and respond in their own time can really make all the difference, rather than trying to rush or go at a pace that you or I might move at. And what's important also to remember is that every single person living with dementia is unique. No two people will experience it in exactly the same way. So personalised care is absolutely vital when we're caring for people with dementia. There are certain tasks that can be particularly distressing for someone with dementia. So personal care activities are a really, really high risk of distress behaviour happening. So things like washing or dressing or using the toilet. So, for example, you might encounter situations where someone would use a plant pot instead of the toilet. And while that might seem odd to us, it often just happens due to confusion or even difficulty with wayfinding. And wayfinding refers to the ability to navigate and move through different spaces. And that can become increasingly challenging for people living with dementia. They might struggle to recognise familiar environments. They might forget where they are or feel disorientated in even the simplest of kind of settings. And this confusion can lead to behaviours like pacing or wandering, or becoming distressed when trying to find a specific location, such as the bathroom or their bedroom. And these difficulties aren't just frustrating for the person, but they can also pose real safety concerns. However, there are some small kind of thoughtful changes that we can change in the environment to offer support and additional support with navigating those kind of situations to reduce that confusion and anxiety. So some simple strategies we might use to support with someone finding their way is to use clear and simple signs. So we would put large and easily readable signs with clear pictures or symbols, for example, a toilet icon for a bathroom, And we'd make sure that they're at an appropriate eye level. And that can really make a difference, because sometimes older adults, their eye level can be slightly lower than where we might anticipate it to be. So that's something we'd want to kind of measure and see where they can really see these signs easily. And we want to make sure that they are brightly coloured and stand out against the background so that they really grab someone's attention. We can use contrasting colours to highlight key areas in an environment. So we could potentially paint the bathroom door a bright colour, or use coloured tape to mark where pathways are. That can really help someone navigate different paths. And it can be really useful to place photographs or personal items outside people's rooms. So a picture of the person themselves, potentially outside their bedroom door, to help them identify their space. And that can work even if they're living in their own home. But it's important to make sure that that picture of themselves is one that they actually recognise of themselves. So it might not actually be the age they are now, it might be from when they were younger. We want to make sure that all hallways and rooms are as free from clutter and unnecessary items as possible, because that can cause confusion or potentially block their movement freely. And sometimes you might find that mirrors or reflective surfaces can actually confuse or distress a person, because depending on their cognitive ability, they might see it as someone encroaching their personal space that they potentially don't recognise. We would always want to try and keep things as consistent as possible. So ideally, we'd keep furniture and other items in the same place to help reduce confusion. If we have too many frequent changes, that can be really disorientating. And try and stick to routines that guide the person through their day. So potentially having the meals in the same room at the similar time of day can help keep someone on track through their day. And what we want to do is ensure that any kind of spaces are well lit, especially in hallways and staircases. Dim and shadowy areas can make navigation a bit more difficult, because you might perceive things that are there that aren't actually there in reality. And you can use night lights in bedrooms and bathrooms to help at night time with helping someone see where they are. If the person becomes confused about where to go, you can use verbal prompts. Depending on their cognition level, it might be something like, oh, the bathroom's just down there on the right hand side. If that's too confusing, you can walk with them along the way and use physical prompts. So you could point to where they need to go, or gently guide them by their hand to help them find their way. What's really important is to offer lots and lots of reassurance. So if someone appears lost or anxious, even just telling them, I'm here to help you, let's find it together, with a really calm tone, can just help reduce that stress and panic in the moment. So what you can do by implementing those kind of strategies is create an environment that actually supports someone's independence as much as possible, while also ensuring that they stay as safe and secure as possible. So another area you might find that you face challenges with is during communication. So someone with dementia might struggle to follow conversations. They might repeat themselves over and over again, or they might just completely misunderstand what you're trying to say to them. And that can be really frustrating for both of you, and is also another big cause of distress behaviour. So what you should avoid doing is don't use a patronising tone, or what we call elder speak. And elder speak is when someone uses a high-pitched kind of sing-song type tone of voice, much the same as if you'd use with a young child. But what we need to remember is that these people are grown adults, they've lived a long life, and they need to be kind of respected and addressed in an appropriate way. And there's a big difference from being endearing and supportive rather than that kind of patronising tone. So instead, what we can try is to speak clearly and use simple instructions that they can understand, that we know they can understand, and get down on their level physically. So you might need to sit or kneel to make eye contact with them, but sometimes that eye contact can make all the difference with someone paying attention and then being able to comprehend. And a really simple thing to check is, do they use a hearing aid? And if they do use one, is it on? Is it charged? And is it working? So sometimes I've worked with people and they haven't realised that the person's hearing aid has gone completely dead. So obviously they can't hear if their tool to hear isn't working. So some other strategies that you might be able to use for supporting with behaviours is to use really clear and concise instructions. And you could break down tasks into smaller, more manageable steps. So for example, instead of saying, let's go get ready for your bath, which is quite a big task with multiple steps involved if you kind of break it down as to what's actually needed, instead start off with, can you take your shoes off first? And follow that then with, can you take your socks off next? So what you're doing is keeping the task focused on something small so that it's not too overwhelming all in one go. And something else you could try is using visual cues where possible. So if you are asking someone to brush their teeth, you might also find it useful to actually show them the toothbrush so that they realise what you're trying to communicate with them. Because the word toothbrush might not mean anything to them anymore, but if you show them the actual object, then that might help trigger muscle memory to then brush their teeth. What we always want to do is offer choices to promote control. For someone to feel like they've got control over their care is a really, really big aspect to kind of overcome. So what you can do is just offer them simple choices. For example, would you like to wear the blue jumper or the green one today? And it might be useful, depending on the person, to potentially limit choices to 2 or 3 options to help avoid overwhelming with too much choice. But again, that's very individualized. And as you get to know the person you're working with, you'll know what they can cope with kind of hour to hour or day to day. And what we want to do is support them in being as independent for themselves as much as they can. So we want them to keep using skills for themselves, even if that ends up being slower than if we can do it for them. But if someone stops using their skills, then they very, very quickly use them. And it's very hard to get those independent skills back once they're lost. So, for example, at mealtimes, you could use adaptive tools like easy grip utensils to help them be able to feed themselves rather than having to do it for them. If someone is becoming upset with a situation, sometimes what we can do to reduce agitation is redirect their attention to something else instead. So, for example, if they've kind of become fixated on wanting to go home, there's a reason why they're not feeling like they're home already. And what you could try and do is potentially say, something like, let's go have a cup of tea and we'll talk about your home instead. That way you can encourage the person to talk about their home in a way that's reassuring to them. And you can also engage them in a favourite activity, such as, listening to music or looking through a photo album or folding laundry, if that's something that they like to do. And remember, always offer the reassurance, no matter kind of where someone is, because it's always really reassuring to hear that someone's there to help you. And that doesn't just count for people with dementia, that counts for all of us. If we're feeling a bit panicky, it's nice to have someone say, it's all right, don't worry, we'll work it out together. We always want to have person-centered care. So it's really, really important that you tailor your approach to their life story and their preferences. So, for instance, if they were a gardener, then spending time outdoors with them or talking about plants or watching shows about plants might bring them a lot of comfort. And they can teach you about what they know as well. Just because someone has dementia, they might be able to teach you about new topics that they used to enjoy when they were able to. And just to touch on meaningful activities. So we don't just want to be giving people with dementia colouring or jigsaws or bingo, which seem to be, they can be fun as well. But a lot of activities like that are the kind of go-to keep someone busy activities. But actually, some meaningful activities might just be washing up the dishes after lunch, or making the table for lunch, or helping prepare the food. So all those, if when someone's been running their own household for years and years, those types of things can help them feel like they've got a purpose and they're feeling valued where they live now. So just to finish up, we would use things like visual and physical prompts. So if you're giving someone an instruction, sometimes even just pointing to, for example, if we're saying to someone, let's put on your shoes, just sometimes pointing to their shoes is enough for someone to then think, oh yeah, okay, I need to put that and put it on my foot. Prompts can go up in level and down in level depending on what the person needs. And lastly, it's really important to adapt to the person. So if they seem tired or overwhelmed, you need to adjust your approach. So for instance, if it's a non-urgent task, like taking a bath, if they are really struggling to manage it at that moment in time, it's always good to try and come back to it later on when they've perhaps had a bit more of a rest or they're not as overwhelmed. It might just be that it's been a particularly busy day, a busy room, and it might just be too much for them at that time. So those are kind of some practical strategies to proactively help you in the moment. There's lots and lots of other things you can try, but obviously today we're a bit limited on time. So I hope you found those tips helpful. It's worth noting, if you are experiencing behaviours that you're struggling to support with, then, please do kind of reach out to me. It's possible that the person you care for just might need some more in-depth and personalised support from a behaviour analyst. So thank you for listening.
Thank you so much, Emma, for sharing advice on how to best support people living with dementia. It was really interesting for me to hear how all these people are unique. So, of course, it's so important to have that person-centered approach and also understanding why these behaviors are happening and all the tips that you share with us. So really very insightful. So thank you. And now is the time for the Q&A for the audience. Just a quick reminder to please use the Q&A session in Google Meet, which is under the activities. If you are on a mobile device, it's under the free shapes. In the meantime, we do have a few questions that came in. So I'll start with the first one around communication. So in a case where you are the carer and your service user is very talkative and active, and then very suddenly they stop talking, what are some of the advice that maybe you can provide in this case where the carer maybe feels a bit frustrated and they're not even sure anymore if the service user can understand them as they used to?
So I guess that depends whether you mean if they've suddenly stopped talking within that session. So if you're kind of halfway through a task, they've been communicating well, and then they stop talking. Some things you could try then is something that's personal to them. It could be that the task of whatever you're doing at the time has become too much. It could be that they are trying to get away from that situation if it's become too overwhelming, or if they've I don't know, something might be causing them pain within that session, or they might just be finding it a very aversive. So I would always try and bring it back to that person. So that person-centered care, you could even ask them, what would you like to talk about while we kind of get washed or whatever. If it's that they've suddenly stopped talking, say from day to day, then it definitely would be a good idea to get any medical causes checked out. It would be a good idea to see if they stop talking every time a particular activity happens, to see then, or okay, is it that activity that we need to modify to make more pleasurable for them? So those are my kind of initial thoughts about what I might do in that situation.
Thank you, Emma. Another question that we received is in regards, for example, again, to confusion. Maybe if that person doesn't remember that a loved one has passed away and they keep asking about them, what is the best approach there?
Yeah, so that's a really, really common thing that happens. And there's two schools of thought in that. Should you keep reminding someone that their loved one has died? I personally don't like to do that, because while I wouldn't lie to someone, I do think, you know, how many times can you kick someone while they're down? It doesn't kind of feel right to cause massive upset to somebody time and time again. What I would try and do in that situation is, so they're obviously missing the person. What I would try and do is redirect their attention and talk about the pleasant memories that they had with that person. So you could say, oh, you know, I can see that you're really missing so-and-so today. Why don't you tell me what it was that you love doing with them? And you can look at photos if they've got photos. And what I always try and do as well is when I work with older adults, I'll always try and get their loved ones to actually record videos. And obviously you have to do that before the person has unfortunately died. But if you can do that beforehand, those videos can bring a lot of comfort to someone when they've actually lost their person.
That brings us at the end of today's webinar. So thank you again very much to you and Pat for offering such helpful insight and advice on how to support clients with dementia. If you'd like to know more about Emma's work, she has a bundle of courses called the Dementia Sessions, which are on her website, positiveagingconsultancy.co.uk. Look out for the email with the recording of this webinar, as it will include a special discount code. We'll be back throughout 2025 with more of these webinars aimed specifically at care workers. So please tell all your teams and other co-workers about them. Thank you very much to everyone that joined us today, and take care.
Thank you, everyone.
Thank you.